Hey, it's Dr. Mike here, physical therapist. If you're someone that recently had a total shoulder replacement and you find yourself having to wear a sling like this, then you're probably wondering what activities you can be doing to help speed up your recovery. In this video, I wanted to share with you the exact same exercises that have been effective for my patients that I typically will give them post-operative day 1 and 2 after their shoulder replacement to help reduce their pain and swelling, increase their range of motion, and reduce any muscle guarding that they may experience. Let's go and dive into this. So when I see someone for the first time after surgery, a lot of the times I see people dealing with, number 1, a lot of pain. Number 2, they're dealing with a lot of muscle guarding. Number 3, they're really not using any of those muscles of the shoulder. So part of your rehabilitation is definitely trying to get you to relax and start using those shoulder muscles again so that you can start to improve the function of your shoulder and get back to normal again. So let's get started with some activities that you can start to work on even while in the sling to help improve your recovery and get things moving again. So one of the first things that I see people often neglect and are not really worried about is they too commonly just focus on the shoulder joint when we have to realize all of the other tissues and muscles that are connected to the shoulder joint. So that includes the cervical spine and the neck. That also includes the elbow and the wrist and even the shoulder blade, okay? So one of the first exercises that we're gonna give you that has nothing to do with moving your shoulder is teaching you how to just work on some neck range of motion. We know that the nerves of the neck exit out the vertebrae and go down into the arm and can sometimes cause numbness or tingling if there's some swelling or compression along those nerve pathways. So what you can start to do to help release and improve some of that swelling is you can even work through some gentle range of motion. So a couple motions we're gonna focus on is working on some neck flexion and extension. We also have some rotation where you're turning your head left to right and even some side bending here. So ear to shoulder. And the reason why I like this so much is we're indirectly affecting the shoulder range of motion. So even though I'm not moving the shoulder, you're improving the elasticity and all the tissue lengthening, especially on the front of the chest, the pec muscles, the deltoid, all through that neck area, okay? So you'll realize once you start to move away and you're looking away, you're gonna get a good stretch through your neck here, a good stretch through your shoulder. You can even explore those areas by looking down towards your opposite shoulder, and you'll start to notice a lot of that tissue that just needs to be loosened up. And you can easily do that in the sling, moving your neck side to side through full range of motion. Okay, so that's the first activity you can work on. The second activity you can work on is starting to get some nice movement of the shoulder blades. We know that the shoulder blade itself is connected to the actual humerus, which makes the shoulder complex. So we want to make sure we're getting some movement of the scapular blades. So what I typically do for my patients is I'll have them go through a few scapular motions, and you're doing this very slowly and you're being cautious and you're not doing anything that's going to cause severe pain, okay? You don't want to go very fast with this. You want to go nice and slow. So I'll have them first start off with some gentle rolls going backward. So almost like they're rolling their shoulders up and over a mountain. So you can go backwards, and then you can even go forward in this motion. So now I'm going towards you, just like this, okay? And then we can start to work on some scapular retraction, or what we would call pulling our shoulder blades back, working those mid-rhomboids and those lower trap muscles on the mid-back. So from this position here, you're squeezing those shoulder blades back. Now when you do this, you're actually facilitating that external rotation of the shoulder. What that means is external rotation is when you take your hand outward in this direction. So you're probably given specific precautions from your surgeon, and it's important that you have close communication with them to let them know on exactly what type of exercises you are going to be doing. But typically what I've seen is shoulder external rotation is typically limited to about 30 degrees, so not allowing your shoulder to go past the 30 degrees of external rotation and not allowing your shoulder to flex past 130 degrees. Now, these are commonly put in place to protect the surgery and the repair, So make sure you're definitely adhering to those precautions. But there's still a lot that we can do adhering to those precautions and get the shoulder moving again. So going back to our scapular retraction, the scapular retraction is basically working on pulling those shoulder blades back, and you're gonna feel a lot of pulling and some tightness on the front of the shoulder, which is totally okay. Okay, so you're pulling those shoulder blades back. We've talked about rolling them back. We've talked about rolling them forward and also pulling those shoulder blades back. So those are some activities that you can do for the shoulder blades. So the next activities that people are more familiar with, because they're usually given a sheet of paper or they're taught right after the surgery, is some active range of motion of the wrist and then the hand. We know that the more movement we can get on the lower end of the arm, the more that it can actually help with some of the swelling and pain that you're dealing with in the shoulder. So we don't want to just be stuck in the sling, not moving your arm at all, because what's going to want to happen is all the swelling is going to want to move towards the hand and the wrist. And sometimes you might realize that you're not moving your hand enough and your hand gets very swollen. So a couple activities that you can do as far as active range of motion of the wrist and hand is you can work on the supination and pronation. And I kind of imagine as if I'm like turning a key, and you'll really start to feel that, especially when you turn that thumb outward, you'll feel that pull on the inside of the shoulder there. You can also work through some radial deviation and ulnar deviations, just medical terminology for movement of the wrist. Now this is almost as if I'm making a hammer movement, okay? And then also some wrist extension and flexion, and this is as if like I'm riding a motorcycle and I'm kind of revving that engine there, going up and down, and that's just gonna help promote some great movement of the wrist. Another activity that can be very helpful is using some sort of silly putty or some soft foam rubber balls that you guys have at home to help start to get some isometric contraction of the deltoid and also the bicep area, okay? This is also gonna help with promoting better swelling control and getting some more just basic contractions, some gentle contractions of the shoulder. Now we're not maximally squeezing the silly putty or the soft foam ball that you have, but you're working on some gentle, really focusing on tightening the muscle right here in the bicep and also the deltoid here. Because I can just literally just kind of squeeze this and not really think about squeezing my bicep or anything. But if you're really focusing on waking up a lot of these muscles again, making sure that we're not getting a lot of muscle guarding in the shoulder, you can really focus on squeezing the silly putty as you're tightening your bicep, as well as tightening the deltoid there. Okay, so that's something that you can definitely do all throughout the day and carry around some silly putty or a soft foam ball with you. Okay? Another area after surgery that I commonly see people neglect is they're so focused on just the wrist or maybe just focus on the shoulder, but they forget about the thoracic spine and how much stiffness of the thoracic spine can influence how your shoulder is moving. So if I have this tight, kind of rounded posture and my upper back is very stiff, when you start moving that shoulder again, it's going to be very difficult for you to elevate your arm overhead because you're going to be so tight in that mid back. So one thing that you can do in the sling is start to work through some gentle extension of the upper back. Now, you can also do this like against the wall or against a chair using a rolled up towel, placing it on the wall so it's going at your mid back, and then you're working on just gentle extension. And it's basically taking you out of this position here, which most people are doing when they're sitting down or even when they're standing, and really reverses that posture and gets them in more of an extension of the upper back. So it helps improve getting that shoulder back nice in alignment with the elbow there. Now, as your surgeon gives you more freedom to start to take your wrist out of your sling here, you're gonna notice very quickly that your bicep and your flexor muscles here are gonna be very, very tight. You might even have some cramping and some pain. And one easy way that you can definitely give yourself some relief there is by simply working on some passive range of motion of flexing the elbow and extending the elbow. And I think the most important part here is the extension of the elbow. And what that means is straightening the elbow out. Because your elbow has been flexed in this position for long hours of the day, we want to make sure that we start to lengthen that bicep and to slowly get comfortable with allowing the arm to just kind of hang down at the side. I don't want you to just kind of let your shoulder round. When you're doing this, I want you to make sure that you're sitting or standing up in a nice, good posture. But as you're raising it up, using the assistance with your other hand, you're kind of gently allowing that elbow to straighten out as far as you can. Gravity is going to allow that wrist to fall down. You're going to feel a lot of pulling on the front of the bicep. But over time, it's going to be very good for your shoulder, because if you just keep your elbow in this position all the time, that bicep's going to get very tight and you're going to be limited with your ability to extend your elbow. Okay, so we're trying to reduce any contractures that's happening in the elbow and want to make sure that you're really focusing on passive range of motion where you're supported with the opposite hand, allowing your wrist to fall down as far as you can get it where your elbow is nice and straight, and then assisting it back up. This is one of my favorite exercises, not only to help control some of the swelling, but to really start to get some more motion in the elbow and eventually start to work up towards the shoulder. So once your surgeon allows you more freedom to start moving that arm outside of the sling, and usually this is done with supervision from a physical therapist, one of my favorite exercises to help improve that overhead range of motion is being supported on a table like this. So then I'm gonna take my arm out of the sling here, and now my surgery arm is gonna be supported by the table, and I'm using my non-surgery arm or hand to gently move my hand upward, reaching towards the front of the table. And what this is doing is this is actually creating more shoulder flexion, okay? The reason why I like this position is now, if I reach a point to where it's just too tight and I can't go any further, you can always improve that range of motion and work with your lower body by indirectly moving your pelvis and moving your hips away. And you might feel a deeper stretch. So not necessarily forcing it forward, but also just using your body and your lower body to kind of move your hips backward and shift your hips behind you. And what you're gonna feel is a lot of pulling underneath the shoulder, all through the lats and the pecs, to help start to improve your ability to raise your arm overhead. Once again, this is done on a table because you are supported and you're not just trying to lift your arm up on your own, okay? So guys, if you found this video informative and you happen to use one of these exercises for your own surgery, please leave a comment below and like this video to support my channel. Thanks for watching today, and I'll see you in the next one.